Hello, once again, Dr. Alalade here at AsktheGynaecologist. And tonight, once again, I'm back online. We were here about 30 minutes ago, and I promised that I'll be back again around this time to talk about urinary tract infection. So I'm here again, once again, live, and I'm your once again, Dr. Babajide Alalade, Dr. J. And tonight I'll be talking about how to prevent urinary tract infection. Many women do suffer from this annoying disease, urinary tract infection, and it has very dire consequences during pregnancy. And tonight I'll be talking about how to prevent this. And I'm sure most women understand what urinary tract infection is. I'll be talking about what it is, first of all, and why women are prone to urinary tract infection, and why urinary tract infection, basically UTI, is very common in pregnancy, and how you can prevent them and how they can be treated. So if you're free, join me and let's have a chat together regarding this annoying thing. So once again, I want to tell you about ATG. ATG is simply called Ask the Gynecologist, and it's one of your biggest groups on Facebook where we talk about medical concerns, most especially female gynecological concerns, and we talk about these things via our post regularly every day, via inspirational quotes. If you've been watching ATG for the last 2 years, I do publish regular online confidence boosters, MindMaster technology, MindMaster things regarding how to boost human productivity and how to boost a positive mindset. So if you've been watching and listening to Ask the Gynecologist for the last 2 years, you will have seen my posts regularly every day. And over the last 7 months, we started a new service at ATG. We started to plant physical presence in Nigeria, and we have a vibrant laboratory, which is a state-of-the-art laboratory for all infertility investigations, for all other medical investigations, including ECG, liver function tests, kidney function tests, all your hormonal profile, everything regarding infertility, including sperm analysis, malaria parasite check, wider screen, HIV, all simple things. And if you want to get married, the test you should do, what test you should do if you're trying to get pregnant and pregnancy is not happening, to check genotype and all these things. And also now we are about to open a state-of-the-art IVF center at Alimosho, and it's called ATG IVF Center. And if you've been plowing that high road to Oshodi, Abeokuta, Agege, Alimosho, you will have seen the huge signboard at night, very bright, even during the day, called Ask the Gynecologist ATG IVF Center. And we're opening that next month, June. So we'll be happy to be on ground, and things shall work out by the grace of God. And if you're trying to get pregnant and pregnancy is an issue, pop in and see what changes can be done in your life, in your home, by the grace of God. I have no doubt about that. And I want to also tell you about ATG as well. ATG, we are all already putting out a new app. We had an old app last year, which was taken down by some unhappy elements. I'll put it that way. But we have a new app now. It's very vibrant. It's going to be released soon on iOS, on Android Play Store, and it's going to serve the whole Africa, in fact the whole world, where you can easily subscribe for our services and you can be taken care of, and you can chat with any of our team members, moderators, including myself, on the app and through the app. And that app will be released soon. We are working tirelessly regarding this app. It was supposed to be released around November, but issues, Nigeria is not stable and currency fluctuations, we have to realign ourselves, and we are almost there. And definitely I'll keep you posted. Most importantly as well, we are on this our ATG. We do seminars every month. Every month we talk about infertility, fibroid, ovarian cysts, and how to cure them, how to treat them. And last month we talked about IVF. This month we're talking about how to achieve pregnancy at advanced maternal age. So at advanced age, if you are in that age 40 and above, you're trying to get pregnant and pregnancy is a problem, you don't want to miss the seminar coming this month. It's every month. And if you're a diamond member, gold member, or platinum service member, you have free access to our seminar this month. Tonight, without taking much time, I'll be talking about urinary tract infection and how you can prevent them, how you can treat them. Obviously, here we on Instagram, we are already live, and on Facebook here we have Adabeke, Sylvia Okonkwo, Chidima Odogo, Ajiboye Alabi Mondinet. We have Emanuela Opala, we have Susan Hyacinth, we have Susan Ekemeze Wachuku, Florence Amber, we have Rose Frank Osaje, we have Monsoa Tabiola Ogumba, Obianwu Nnaemeka, We have Zena Bello, Florence Amba. We have Blessing Emeka, Egbeyin Katemi. We have Tony Ekpo, Emi Ikatwa, wonderful lady from Benin. Monueke Adaogo Omewa, wonderful lady. She had a pregnancy recently. And we have Blessing Emeka here. We have Florence Amba. She's already invited her friend Becky Lawrence. If you're here, your friends are not here, invite them to Facebook to watch us live now. And on Instagram, I have so many names. Unfortunately, on Instagram here, there are names I can't produce. Some names are like nicknames. We have Chidi Ebere Joy Ubana, Josie Brown. We have Josie Brown also. She wants our IVF number. Josie Brown, just send and go to our profile page on this our ATG, and you see the number to communicate with us. You see the email to communicate with us. Send an email there, and we'll get back to you before Monday. We open the IVF center. One of our team members will reply to you, and you can get across to me through that number, or you can call the IVF number, and the lady there will take you through things. Her name is Nike. She will attend to you. We have Omobolanle Abeni. Our email, by the way, is atgservices2018@gmail.com. atgservices2018@gmail.com, and someone will get back to you. So thank you so much here. And back again to Facebook. We have Didi Basi, Falilat Ibrahim, Novet Eva, Emily Elozino, Afo Elozino, Gifting Kechi, Aguntoye Adejoke, Blessing Emeka, Chinyeri, Ilhuebu, Constance Ndobisi Dandi, Pat John, Inyama Momo, Rema Akubom Ndam, Giselle Nji from Cameroon, Yaoundé, Ajala Kemi Olajumoke, Bere Ubana, and Igbere Awo Carol Best, Chioma Osakwe. We have Enyama Momo, Ogochuku, Oko Richard, Monsura Tabiola Ogumba, Brenda Mimi Ngweta. We have Florence Hamba. Thank you guys here. And over here, Aji Lore, Temindayo, Florence Mba. Thank you. So, Unwuye Marcelo Josie, Unwuye Marcelo is here. So, now, what is UTI? I said again at the introduction. UTI is urinary tract infection. Basically, infection of your bladder. And why is it very common? Anything can cause infection of the bladder, including E. coli, Klebsiella, Staph aureus 2 in very rare circumstances, and so on and so forth. The reason why UTI is very common, urinary tract infection is very common in women, is that because, as we all know, the urethra for the woman is very short. Very, very short. You know, for the man, for the male guys, this is your penis, and this is scrotum, and then your bladder is here. The length of the urethra, that is the one that takes urine outside, to your bladder base is very long. It's very long. It's a long way to Mexico. Long way. So the distance where urine has to move from your bladder here, okay, and go through all the way to come out is very long. Okay, compared to the ladies, the vagina. Let me draw the vagina for you. So this is let me see if everybody can see me here. That is the vagina there. Okay, that is the anus for the woman. Okay, and that's the urethra hole where the lady will pee, and that's the vagina here, the V vagina, the urethra. That's the exit, and that's the A for the anus here. Okay, the bladder for the woman. This behind here is the bladder. The length here is very short, so it's very easy for infection to travel from the urethra to the bladder. Very easy. But most importantly too, because the vagina is very close to the back passage, it makes the infection travel easily, very short, to get the urethra and then transverse down into the bladder. And it makes infection very, very easy for women to contract. And most importantly too, in pregnancy, there's a change in the environment which makes infection have easier access to the bladder and makes pregnant women much very prone to urinary tract infection, and it can increase the risk of pregnancy loss or increase the risk of preterm labor. And so if you understand that women are prone to infection, that means that as soon as a baby girl, as soon as a child, as soon as a girl is already able to wash herself and to go and pee herself, we as mothers, we as dads or caregivers to our female to our children we need to let them know how to clean up. Important, non-negotiable. It's important, and I'll be explaining so many things here that must be done to reduce the risk of infection. Now, number one, nature is designed in such a way that nothing stays. Everything must keep moving. It's either you're moving forward in life or you're moving backwards. It's difficult to stay stagnant. You're driving on a highway. It's either you're moving in one or the other direction. You can't just stay and park your car on a busy highway. You cause accident. The same thing in nature too. You breathing in and out. Hair must keep going in and out, up and down in your lungs. The same thing too. Blood must keep flowing in your blood streams, in your vein. The same thing too. The bladder. Urine is stored in the bladder, but after a while, if it's stored and it does not go out, it becomes a good location for infection to grow. So if you're keeping fluid in your bladder, urine, and you're not passing them at consistent regular interval, you're going to increase the risk of infection in your bladder, whether you're a guy or a lady. But ladies have higher increased risk of developing infection in their bladder if they hold their pee for so long. That is why once you're a lady, obviously you're pressed, you want to go pee, don't hold your pee in your bladder. It causes over distension and stretching of the bladder, and it decreases and damages the ability of the bladder to keep and control its sphincter. The sphincter in the bladder is designed in a way that it holds the pee until you're able to get to a convenient spot to pee. But the more and the longer you hold the pee in your bladder, the much damage you cause to the muscle that keeps pee inside. That sphincter, that control that keeps pee inside. So don't hold pee in your bladder for too long. It causes damage to the bladder wall by causing over distension. And stress and stretching of the bladder. So don't keep pee in your bladder. Learn to pee regularly. Number one. And to prevent the pee staying and standing too long in your bladder, you need to drink lots of fluid. The more fluid you drink and prevent dehydration, the more easier it is for urine to keep flowing and you peeing regularly at the right time. You need to drink plenty of fluids. If you don't drink fluids, you're going to increase your risk of infection as a woman and as a man, but much commonly in a lady. You need to increase fluid. And when I say increase your fluid, I'm not saying to drink to death. I'm saying drink to moderation, drink to thirst. And when you're drinking fluid, avoid all these Coke, oranges if necessary, and go for pure water, clear water. Clear water helps to keep the bladder washed and reduce the risk of urine infection. That's number one. Number two, another thing that could reduce the risk of urine infection is a particular juice, obviously, called cranberry juice. If you're able to get cranberry juice, the cranberry juice itself, that fruit contains some particular type of sugar. Not any sugar, a particular type of sugar, called D-mannose, which reduces the risk of infection and reduces the ability of infection organisms to get stuck to the bladder wall and to proliferate or to become plenty in the bladder base. Cranberry juice. Number two, hygiene. And number three, hygiene. Whenever a lady, a baby girl, a child, a female child is able to wash themselves or to take care of themselves in the toilet, we must teach them as mothers. We must teach them as daddies. We must teach them as caregivers. They need to wash from front backwards. Don't wash from backwards front. That is to say, if they are doing tamba or washing, okay, don't wash from backwards to the front, okay? Wash from front to back. Am I making sense? Let me make this clearer. Let's get all this cleared up so that we make things easier for people to understand that are just joining us. If you're just joining me, my name is Dr. J and I'm here at your service. Now, if you want to sign up for our programs, antenatal care, GTC, please, since August last year, the GTC program that is getting ready to conceive has been increased and is now pegged to 6,999. The antenatal, if you're already pregnant, okay, is been pegged to 7,500. That's since August last year. So if you want to register for the antenatal service on ATG or the GTC, those are the prices, okay? For your information, please take note, okay? Now let us move quickly to talk about how to look after the vagina and prevent urine infection. If you're just joining me, the first point is to drink plenty of fluid. preventing dehydration, preventing dehydration. The number 2 thing is to pee at regular intervals, preventing over distension and stretch of the bladder wall. By peeing and go to pee, urinate at regular intervals, you're going to reduce this damage to your bladder walls, okay? And number 3, I said this to ensure you're drinking cranberry juice if you have an infection, okay? Cranberry juice contains some good, lovely elements there that they reduce the ability of the infection to stick to the bladder wall and cause infection. So I said cranberry. It's very common, available in Nigeria. Cranberry juice, okay? Cranberry juice, okay? Cranberry juice, okay? Very good. Now let us move to the need to teach young girls how to wash. Now, you remember I made a diagram and I did this, okay? Now that is the vagina, okay? Now this is the back passage, the anus, okay? Okay, and this is the vagina hole here where baby comes out and which people use for intercourse. And over here, just above the vagina entrance, is the urethra. And there's always a small opening on the 2 sides here. If you can open your legs on your own at home, put a mirror in front of you, you see your urethra here, and you see on 2 other sides here a tiny opening there. That opening there is opening for you to produce secretions to lubricate your glands, to lubricate your vagina, to make it supple, wet for sex as well. And you can also see another opening here as well that also helps to lubricate the vagina, okay? If you're very, very vigilant, okay? Cranberry, not cranberry. Now, because the anus, okay, contains so many things, infection and all that, the anus is basically the sewage tank of the human being. Your anus is basically your sewage tank. There's so many things there, organisms growing there, that they don't do any damage in the anus or in the colon. But if you wash, okay, from back to front, okay, back to front, okay, back to front, okay, and back to front, okay, you're giving the organisms there in that back area ability to move and then to go and infect the urethra. And once they get there, they migrate inside the body into the bladder, which is just sitting above your tummy there. And it causes infection in the bladder wall and causes irritation. And every time you go to the toilet to pee, you go and pee every 20 minutes. And when you're peeing, there's a sharp pain when you're trying to pee. And not if you're pregnant. As a pregnant woman, you pee frequently compared to other people. As a pregnant woman, you pee more frequently compared to other people, okay? But most important thing is that whenever you go to pee as a pregnant woman, there'll be that sharp pain, that burning sensation in your bladder area. There'll be that sharp pain, that burning sensation in your bladder area when you're peeing. Now, that could be a sign of infection. Plus fever, you're feeling unwell. If you start to have fever, you're feeling unwell, when you have infection in your bladder, it could be a sign of urine infection that needs to be treated urgently. Because once infection gets to your bladder, it has every ability to move into your urethra and get into the kidneys. And once it gets into the kidneys, it causes sepsis, full-blown sepsis. You need to be hospital, okay? Hospital, straight away. Now, so avoid, and your lady, young girl, anything, your female person, avoid washing from back to front. If you're going to wash, you're going to tamba, you're going to do the toileting, okay? You do it from front to back. So no back to front, no back to front, from front to back, okay? This is good, this is good. You wash downwards, okay? So, if you're cleaning up, it's important, okay, you clean from back to front. If you've noticed, most people, just after you have intercourse, people are very prone to having infection, especially urine infection. It's because during the course of sex, there's that inward, outward, that trauma that your husband, your spouse is putting the penis in and out, okay? It causes stress. It causes, so this is the vagina, okay? This hole here is vagina, okay? That's where the penis goes. During sex, there's in and out, in and out. there will be trauma. The skin there will be a bit traumatized, okay, and it will be a bit excoriated. Some damage which you can't see. You can only see it on microscopic level, and because of that same damage in and out, there will be some stress too on this skin around here, close to the urethra. Urethra is the exit for urine to come out from a lady, because from a lady or a man anyway. But for these purposes here, for a lady here, during sex, there's stress in that area, and it makes that area a bit stressed out, and infection can easily move into the bladder. That is why a woman does have sex, within 5 days she has a water infection, and every time she meets her husband or spouse, she has urine infection, water infection, urine infection. What you should do, if that is your case, is that after sex, always go to the toilet to pee. Immediately you finished having sex with your husband, with your spouse, go and pee. It helps to push any infection that has just moved into your bladder out. People will say, doctor, but if I go and pee after sex, that means that the sperm will be pouring out and I won't get pregnant. And sister, if you've been in ATG and you're an ATG member, you're already in an ATG university. I've said it time without number that a good sperm count, a good sperm, as far as it has been deposited into your vagina, will swim into your womb cavity and get you pregnant, okay? What you pee out after sex that looks like sperm, it's not really sperm, is semen. Semen, okay, is the cover of the bullet. Okay, the bullet contains gunpowder. The gunpowder is the sperm. The semen is the boss. The passenger is the sperm. Once the semen has been deposited into the vagina, the sperm are automatically designed by God to move into straight away, enter into the womb and go and look for the egg. After a while, the semen will pour out. The semen is just a juice. The semen is just a suspension. The semen is just a conduit, a pipe, a container that contains nutrients to allow the semen, the sperm, to survive in your vagina, to survive in your womb until you get pregnant. Okay? Now, what can cause urinary infection? I said again, any organism, E. coli, Klebsiella, and stuff like that, that can stay here. Some people will go for urinary test, and they will tell them they have epithelial cells. Epithelial cells are part of your body. Now, whenever you go to pee, you have vaginal secretions always around your vagina. As you're peeing, your urine will wash out those secretions. Your body is designed to shed cells regularly. As you're peeing, your urine will wash out some of your body cells. As your body is causing what we call desquamation. Your body will exfoliate, regularly. So all those things will be washed out in your urine. And if we collect a urine sample in lab, we put it under microscope, we see epithelial cells. Those epithelial cells are cell linings around your urethra, cell linings around your vagina, and part of your natural, normal vaginal secretion. They are not harmful. But if we culture your urine in laboratory and we see infection, we see organisms that are potentially causes of urine infection, then we treat them as soon as possible. Okay? So back again, after sex, always go to pee. As far as the sperm is good, it will get you pregnant, except it's a bad sperm. And to get pregnant, I always say all the time, have regular intercourse, not sex only at your convenience. Have regular intercourse, not sex only during ovulation. Have regular intercourse, not sex only after a period. Have regular intercourse. And when I say regular intercourse, I say all the time, and I say with seriousness, please listen to me. Regular sex is sex every 2 to 3 days. Don't wait for ovulation before you have sex. By having sex only during your ovulation, you're only giving yourself only 30% to 33% chance of getting pregnant. By having sex during your ovulation, you only give yourself chance of getting pregnant only 33%. That is very low. But to maximize your chance of getting pregnant, to increase your odds of getting pregnant, to increase your pregnancy rate, to make you get pregnant much easily, have sex every other day. Maximum every 33 days. The only time you're free from sex is during your period. Now, there are some products that people use these days now that causes irritation in your vagina. Anything you're using, especially perfume product on your vagina, avoid them. Any perfumed product on your vagina, avoid them. They cause disharmony, they cause damage, they cause discomfort to your vaginal skin. Okay, and they increase the risk of infection being able to penetrate into your vaginal wall, into your urethra, and potentially lead to urine infection. Okay, sometimes too, if you're using a particular birth control method and you realize that you're always prone to urine infection with this particular birth control method, maybe it's time to consider change of your birth control method. I'm not saying birth control method will cause infection, but some birth control method for some particular people might increase the risk of infection. So if you're on a type of birth control method, maybe a coil, copper, marina, and you see that you're prone to urine infection all the time, probably you should change them, because there's no best birth control method. You might have a good control method for now. After some 3 years, 4 years down the line, that good contraception might not be the best for you at that point in time. You might need to consider something else. Because your friend, if is using a particular birth control method, doesn't mean you, Chinedu, must use that birth control method. What is good for the goose might not always be good for the gander. We have many birth control methods, okay? And even for one person, a birth control method may be good for this time now, but in the next 2 or 3 years down the line, she might need a different birth control method, even for that same patient. So it depends on lifestyle changes. It depends on need. It depends on your lifestyle condition. It depends on your medical condition. It depends on your story. We consider a change. If you're being prone to urine infection, we might need to consider changing your birth control method if you're in particular birth control method. How do we treat urinary infection? It's very simple. In most cases, what we do is to take a urine sample and send it to laboratory to check for infection. And if we find them, we'll now look for what particular antibiotic is specifically useful to treat that urine infection. In some cases, because there's going to be a delay before we get the urine test back, we don't want to waste time. We start you on what we call broad spectrum antibiotics that cover everything. And once we get your results back from the laboratory, we might need to tailor your antibiotics to what suits that particular infection that we've cultured from the laboratory. So usually we start you on the broad spectrum antibiotics that can cover for many infections. So once we get the urine sample back, we now tailor the antibiotics to what is specifically useful to treat your own particular type of urine infection. Remember, I said again that in pregnancy, you are at higher risk and much prone to urine infection in pregnancy. Therefore, if you're pregnant, if we find any sign of urine infection in your bladder, in your urine, anywhere, we treat you immediately without delay. Because by not treating you with antibiotics in pregnancy, we risk urine infection leading to preterm miscarriage, or leading to preterm birth, or leading to stillbirth in very rare situations. So if you have urine infection in pregnancy, it must be treated even more aggressively compared to a woman that is not pregnant. Someone is asking question. Thank you, Abigail, for being here. Abigail Itohan Joseph, Ojini Abada Iduduruji. She's saying that how good is pre-seed for someone trying to get pregnant? Pre-seed is good. What pre-seed does is not to increase your egg count. It doesn't increase your sperm count. It only makes the vagina very conducive and very attractive and very palatable and enjoyable for sperm transport, for sperm survival. Pre-seed will make your vaginal environment much sperm friendly, for sperm to survive longer, swim faster, and live better, and get to the target, to get to the egg on time without delay. Urine pills, I have no idea about them. Urine pills, do not use them. They increase the risk of urine infection and they increase the risk of damage to your vagina. Urine pills, avoid them. Urine pills, run from them. Urine pills, run, pira from them. Thank you. Adejumobi, Adebanke, God bless you. Ojini, Doroji, thank you. Christina, I can see a question here. Chomi for King, she's saying that she's having serious constipation at 31 weeks. What can you do? You drink enough water. If you're having serious constipation at 31 weeks pregnancy, try and get lactulose. Lactulose will make your stool soften. Okay, good. And still keep drinking your lot of water. We have IVF Center Lagos now. It opens in June. So if you want to get settled in to the IVF Center ATG, you can pay now and start paying for your service instrumentally. Just call Nike on Monday. She'll open a file for you and you can start depositing. Urine pill is not good. Urine pill is not good for your vagina. Urine pill is not good for your toto. Your urine pill will damage your toto. It will damage your vagina. Urine pill, don't use them. Tolani Omo, thank you. ST Kampala, thank you. What causes watery discharge after a period is normal, is safe. There's nothing wrong with watery discharge after a period. Some people have it, that they have clear discharge after a period. There's nothing to worry about. It's perfectly okay. Sir, what is your class of multiple pregnancy? Yes, Abdul Rahman will start the class of multiple pregnancy soon. Just stay tuned here and don't run away. Olajumoke Taiwo Adeyemi, to pay for the IVF, just call the laboratory on Monday. Nike, if you're there, any of our moderators, Gloria, I can see Christina, I can see Vivienne. Please help me link. Thank you, Vivienne, for putting the link up for Olajumoke Taiwo Adeyemi for the IVF section, IVF facility. Tessie Ezenwa, I've already mentioned and explained epithelial cells already. I've already explained it in this video. Please watch the video over again. I've already explained what epithelial cells is in urine sample and their significance. So you just watch the video over again. Doctor, you want to have a personal discussion with me? Oyedele Adejoke Adenike. Very easy. Vivian, please help me tag Oyedele Adenike on our link to chat with me one-on-one. Thank you so much, Chisom Benedict. Kevin Uchi, thank you. God bless you all. Hope to see you back. Stay tuned. We're coming back again in the next 1 hour. I'll be on again live to talk about a very, very important and interesting topic. So stay tuned and don't go. My viewers on Instagram, thank you guys. I will see you soon. Stay tuned and don't change the dial. See you. Bye-bye.
So me mu bra me de hene wo makume mu embo me hu me don pimu du me hu ade paw inkule nu to kateka embo me ka wo se makoma don sa me hye ne ma pompo dodo pampana na wo hema bra na me nya o kana na I can feel it in my soul, you the raw one. What's so one on penny gold, name is silver. What my soul be me do